In Section 2, we're going to talk about XR applications in the curriculum. Specifically, we're going to look at three following domains, the first of which is knowledge, specifically anatomy, the second, skills, specifically simulation, procedural training, and triage skills such as mass casualty triage, and then empathy, where learners can experience illness through the patient's eyes. So for the first part of Section 2, we're going to talk about knowledge applications in the curriculum. And it's important to start off this section in talking about what we currently do for anatomical training. We often use full cadaver dissections, which involves the use of donated human tissue in the form of a cadaver, shared amongst teams of 3 to 4 students through an anatomy course that runs over the course of several months. Now, for a class of about 100 students, this means there's a cadaveric need of about 25 specimens for that class. And when you think about the size and scope of anatomy course that lasts for months, there are a number of costs that include the cost of the cadavers themselves, the cost of storing the cadavers for a period of time, the cost of taking the cadavers from the donors and embalming them or preserving them in a manner that is suitable for the dissection that will entail. And there's often a staff cost as well to keep these labs running and functional. You have to think about the facilities costs as well as just the size needed to house 100 students or at least 25 specimens for use of dissection. Now, these costs have led to the development of other options for anatomical learning. There is the use of plastinated specimens, which uses a special kind of preservative that takes the human tissue and puts it in a way that it does not have to be stored in a similar setting as an anatomy lab. You still have the space concerns for the number of specimens needed, and also these plastinated specimens, you can't really dissect them, so these are more of models using real human tissue. Again, the cost for this is a little bit higher because you're talking about $14,000 to $16,000 per plastinated specimen, and seeing that you can't really dissect them, you need multiple versions of the specimens to depict different levels of dissection. This has led to the improvement and development of 3D printed specimens, which again don't use any human tissue and can be printed ad hoc by the needs of the learners or the instructors. Now, while the costs for 3D printed specimens can be as low as $300 to $600 per specimen, you still have to factor in the printing costs, the cost of the printers, the labor costs of setting up the printers, and the expertise needed to render these models and put them together, in addition just to the time it takes to print one specimen. Again, since you can't necessarily dissect these models, for every group of learners, you'll need multiple specimens to depict different stages of the dissection. This has led to the popularity also of virtual dissection tables, as you can see on the bottom, which essentially is a large tablet using a 3D model of human anatomy. Sometimes this can be paired with CT or MRI or plain film imaging, and users can interact with this table. Now, with the same small group formats, you're going to still need about 25 of these tables for a group of 100 students, and the challenge being that the cost for these tables can be significantly higher at a cost of anywhere between $60,000 and $80,000 per table. So let's see how VR and AR can factor into these environments. On the left, we're going to look at Organon VR, which again, fully immersive virtual reality environment where the users can use a controller to interact with and virtually dissect the specimen. On the right, you have Holoanatomy by Case Western Reserve University, and that is a hologram placed in the physical environment where it's sitting here on top of a table, and multiple users can interact with this specimen. Of note, you will see that behind the instructor with the red sweater, there is a picture of the Organon 3D VR setting behind them that someone else is using. So these modalities can be used together in a multimodal learning environment. When we take a look at Organon VR, you can see that the learner is in an office setting, and the screen is depicting what the learner is seeing in their heads-up display, or head-mounted display. You'll see that they're able to interact with the specimen. They can pull in learning materials, as you can see on that screen behind the specimen. They can move in and zoom out by simply moving their head closer to and further away from the specimen. They can use the controllers to raise arms and limbs or remove certain areas of the model for further investigation. The nice part about both AR and VR is it allows the learners to get into more detail than they could in real specimens. You'll see in that example that they were able to get down to the multiple layers of skin and all the way down to the tiniest blood vessels, which you can't often do in a real anatomic dissection. Let's go ahead and take a look at hollow anatomy by Case Western now. Let's go ahead and take a look at hollow anatomy by Case Western. In this environment, you can actually see multiple student learners gathered around a single hologram in a study hall, classroom, student lounge environment. You can interact with this rendered model by touching it, by zooming in and zooming out. They can move closer and further away, and they can collaborate together. You'll also see that this instruction, similar to VR, allows materials to be presented within the animation and allows the users to interact with that. Different specimens can be shown. One of them is a full cadaver with skeleton, and one of the other images you saw was a cutout of just some of the heart and liver anatomy. So let's take a look at the use of anatomical learning through mobile devices such as smartphones and tablets. On the left, you'll see visible body, and on the right, you'll see 3D Formedical. Again, the quality of the rendering of the anatomical specimen is on par with the fully immersed Organon VR as well as Case Western, but you'll see that the users have to interact through their device in order to interact with these AR projections that show up on the table. Again, they have to look through the smartphone screen to see the model and interact with it. And so this begs the question, even though this will likely be a lot more cost-friendly than full immersive VR or other AR models, is the benefit of being able to look into an AR space, does that outweigh the use of just having higher quality 2D video or annotations? Something to consider.